stressful situations. Know that your cognitive and technical faculties will deteriorate under stress. We have to mitigate this and then train technical skills with that in mind. I was a police officer for 20 years. There's times I was in situations that were a little hairy, and then later somebody would say to me, "I was yelling at you." What was in his hand, and I couldn't hear it. Our senses don't always respond well under stress. But if we know, I think you're saying, if we know about that, we can deal with it.
Yeah, 100%. 100%. I think this is also a disservice that we do to anybody who works under these conditions: law enforcement, fire rescue, EMS, military. Unless we talk about this stuff, I really think we're doing a disservice to people. And of course, this is my soapbox, so forgive me if I kind of go off on this one. But what we really, yeah, thank you. What we really don't tell people, what we really don't explain, or I think even at the most basic levels, is to people, is that under very stressful situations, when you perceive that it's like, oh my gosh, I'm not sure exactly what to do here. Maybe it's like a pediatric cardiac arrest. And you're like, oh my gosh, his parents are here. I haven't run a pediatric cardiac arrest yet. I remember PALS vaguely, but I haven't done one in 2 years. That sense that your faculties are not going to be enough to meet the demands of the situation, or that something is unclear, uncertain, potentially threatening to you, generates this stress response. And the key thing to remember is, for the longest time, I thought it was just about, it changes how I feel. Like, I get a little stressed out, it changes how I feel about things. But what is so important to remember is that state fundamentally changes our brain chemistry and electrophysiology. And the extension of that is it changes everything from our hemodynamics, our heart rate variability, our peripheral vascular resistance, and our cardiac output, to the sensory perception that you talked about. People getting what we call, at least in the human factors engineering world, is increased selectivity, or that tunnel vision, auditory exclusion, which is the example you gave. And there's tons of examples of that in the world of aviation, NASA, the military, fire rescue. Someone says something. In fact, sometimes they're screaming at you. Sometimes you're even saying, okay, but you're not processing that information that they're telling you. These are all super, 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 super common perceptual changes, as well as different behavioral aspects. So we have what's called cognitive perseveration, or the sometimes called the broken record effect. So have you ever seen like a new paramedic, they're going to intubate someone, and whether they're using VL or DL or whatever they're doing, they're just kind of fishing around in the mouth with the blade. And you're like, hey, tell me what you see. And they're like, and they're just kind of like moving the laryngoscope around with no specific goal-directed behavior. It's because their brain is not necessarily able to solve novel problems, find new solutions to the problem that's presented to them. And if they don't know what to do, they just default over and over again to what they do know how to do, or what they think they know how to do. And so there's all of these changes that occur when you're very stressed out. I think there is relatively good evidence that suggests that if you train appropriately, you can actually, and understand that, you can adapt to those effects, right? You can actually perform better, more precisely, maintain some of those cognitive and technical faculties, even at higher levels of stress. And I think it starts with just presenting this information. In fact, there's some data that suggests that just by adjusting people's expectations, that they perform better. And that kind of matches my experience and the experience of a lot of people I talked to. I used to think I was stupid because, like I knew the dose, of cardiac epinephrine or cardiac epinephrine in cardiac arrest, or I knew the dose of some fundamental, very simple, straightforward medication. Easy. If you and I were talking and you started grilling me, no problem. Bam, I'm throwing out answers. There you are in the back of the ambulance at 2 a.m, tired, half awake, and someone's super, super sick. And it was like the information evaporated from my brain. And I just thought that I was stupid or dumb, and in fact that it's not the case. It's a very common effect of stress on your ability to retrieve information from long-term memory. And it wasn't until someone explained that to me, it's like, oh, it's totally normal. Happens to everybody. Very common. Doesn't matter how smart you are. Doesn't matter how experienced you are. A lot of these effects persist. and they can affect you. And when people understand that, I think that that's step one to solving the problem. Is like, okay, it's normal. And when you normalize it, then you can begin to adapt and train to it. And a lot of that adaptation and training takes on um, very diverse and different ways of applying that. So number one, applying, even in didactics, teaching, whether it's a whiteboard or whether it's PowerPoint, understanding how people learn and how people retrieve information, and simplifying as best we can complex concepts so that people can actually retrieve it better or easier. The way that we actually develop simulation train, the way that we develop hands-on training, tabletop, all the various ways that we apply and execute our educational modalities across the spectrum, combined with a host of other things, whether that's psychological skills, training like you're essentially an athlete, training and understanding some of the sports psychology and performance psychology that is very common in other domains, to developing systems to actually to decrease the cognitive load, to make everything simpler and more achievable under those stressful situations, to finally coming up with ways to actually push people, to challenge them, to get them to understand how they respond in these stressful situations, and then give them the opportunity through simulation and other training to actually test out some of those skills, come up with their own personal way of adapting to it and dealing with it, and then continually challenging them, continually making it harder for them, so they're always having to push themselves a little bit outside of their comfort zone. So I think it's absolutely critical. It is something that we don't talk about enough, and it is something that we can absolutely address.